Disclaimer. The discussions and personal opinions of the guests do not replace professional advice. It's recommended that you seek your own independent professional mental health or legal support to meet your individual needs.
I'm going to add in, I actually saw a really interesting double empathy issue on a reality TV program that has lots of conflict that's running at the moment. But the irony was, for example, maybe Joseph, I confided in you and I had said something. And so if you're neurotypical, you think, okay, well, she's told me this, Rachel has said something. And then you out me to a group saying, well, Rachel said this. And I might say, no, I didn't say that. There is no way I said that. And people look at me and they might say I'm denying it, which I'm not. And then the person actually came back and said, I specifically said X, Y, Z and recounted word for word what she had said. And I saw it as she's absolutely 100% correct. So is the neurotypical person 100% correct. And they were just in an absolute argument with each other. And no one really saw that on a reality TV show, but nobody really saw that both were correct and no one could meet in the middle.
100%.
So it happens all the time, right?
For sure.
So I guess then it brings me to ask the question of how are your groups running? It's a really popular and a high interest into the program, but how are they going?
Yeah, they've been going pretty well. I'm very proud of them. I think we ran 2 programs last year. We had an in-person and an online, and we've just actually kicked off our 2025 first round last week. They're going pretty well. It's been interesting last year, especially the groups last year were very much during the process of Joseph and I creating and refining the content. So that was a bit of a challenge. But I think we really kind of came up with, by the end, a model that we're really proud of. We have found a lot of enthusiasm from participants and a lot of real insight that's come from the program as well. I've been really, really lucky to be able to have some interactions with some of the participants post the program in individual therapy and things like that. And I've been getting some really positive feedback about how people have kind of been gaining from the program, looking back on the insights. I think one of the things that I'm proudest of about the program and the way that the groups have kind of worked is that we get to have a lot of discussions. It is a skill building and collaborative discussion kind of group. So we have a lot of discussions throughout the program about each of the skills and about all of these various topics that we're talking about. And I think we sparked some very interesting discussions about masking, about meltdowns, about shutdowns, about coping mechanisms, about sensory profiles, and being able to kind of explore those discussions in depth, I think, and not just participants learning from us, but us learning from participants and participants learning from each other. It forms this really beautiful kind of community aspect of the program. And that's something that I really love about it. And also to see, it's kind of like a really large version of one of my favorite things about being a neurodivergent affirming therapist, which is getting to be part of people's, oh my God, my life makes sense moment.
Yes.
That's one of the joys about being part of like assessment and therapy for neurodivergent people, especially being like diagnosed myself. And it's a very large scale version of that constantly. So that's been really fun.
Yeah.
Joseph?
Yeah, so we've been running the program for the 3rd year now. So the first year was with another clinician that I've worked with. And what I find really valuable is the client's feedback. So because the way the program developed was, based on feedback from participants of what works. And we've had some very interesting discussions about this, Nimasha, right? Where I would kind of talk about, this works. And Nimasha said, so far, it doesn't really resonate with me. And then, of course, I asked feedback from the participants and they said, no, it doesn't work.
Can you give us one of those examples that you might have tried earlier on in the program that didn't work and maybe didn't resonate?
I mean, I think one that probably is coming to both of our minds is the willing hands.
Yes.
That was definitely a skill that I personally have never quite related to. And when I was when I started kind of looking at the interpersonal effectiveness skills from a neuroaffirmative lens, a lot of them, and sorry, not just the interpersonal skills, but all of them, some of them were very based in neurotypical and nonverbal communication. And to me, willing hands felt a little bit too much like masking. I didn't quite, as a human who struggles with interoception, and feeling connected to my body in that way, as a lot of autistic people do, the concept of putting out my hands to indicate willingness, I couldn't connect with.
Yeah.
That being said, Joseph, we had a discussion about it, and we did incorporate it into the program, just in a bit of a smaller way than otherwise. But yeah, it was an interesting moment to kind of get feedback from participants.
Yeah.
And to be fair, we did get a even split. We did get people who found it helpful and thought it was interesting, and we got people more like me who just didn't really connect with it. So
Which I know we said previously how like willing hands sometimes, if they were invested in it, could just be more that learned behavior side as well.
So just to put things into perspective, because we're saying that, we introduced the concept of turning the mind. Okay. And usually you kind of add some kind of a behavioral component and say, willing hands. So if you combine willing hands and turning the mind, then that helps, right? So I introduced I was discussing that concept with Nimasha in terms of, so implementing this as part of one of the mindfulness exercises. And then I did ask the participants to kind of, do their willing hands while they turn their mind. And then I did ask for feedback, and very interesting feedback from clients. And
you're going to get honest
for sure.
Yes.
Very honest and very blunt feedback. And saying to me that doesn't work for me because this person felt that it was contrived. It's like, do I really have to do that when I'm already turning my mind? It's just too much. And that makes sense, right? It's like, do I really have to do that when, I'm already turning my mind, so for them, it felt really contrived.
Yeah.
And it makes sense, right? And I really appreciate that input from one of the participants. Did you remember that, Nimasha?
Yeah. That was a fun discussion.
Yeah.
I also think, in that vein, on jumping off the concept of things being contrived, I think something that was really fun for us during the development of the program was also trying to make as many things concrete and clear as possible. That was one of the huge shifts. Right? Yep. Yeah, not the language, but also the articulation of how these skills can play out in the real world. Because I think psychology, we do our best. I think we do a great job collectively, but I think psychology has a tendency to say some abstract concepts and, say tools
use
in
a lot
theory.
Of jargon and big words.
There's a lot of jargon.
Everybody.
Exactly. And something that we really, one of the big facets of particularly being autistic is often, needing context. It's bottom-up processing. It's needing to know the information to really feel like you understand something. And one of the things that was very important to us was changing some of the language and changing some of the skills to make it very clear. So as we kind of wrote up the program, it was also about, writing up explanations of, here's what's going on in your body or your nervous system when this skill is happening. This is why this works. This is why we are asking you to do something. And not just that, but also here is a worked example of a real life scenario of a neurodivergent person using the check the facts skill or the opposite action skill or things like that, just to make it as clear as possible. And that was also where, that my brain just kind of jumped from there to, from the contrived comment, but that was also a part of this that has been really interesting.
Following on from that, actually, I had a question about one of your mindfulness skills because it's a really great one, I think. But you have in your program mindful stimming, and obviously stimming is something that an autistic person does to cope. How did you take that? Well, how did you take stimming and then integrate that as a mindful stimming skill that you can learn into your program?
Yeah, I mean, I think stimming is something that probably has been talked about pretty widely. Gee, my God. Words are hard, sorry. Stimming in general has been talked about pretty widely. And as we were kind of going through mindfulness exercises, the thing that the evidence was telling us was that mindfulness can work really well with neurodivergent people, but there are nuances to that experience. You know, as neurodivergent people, some of the things that make it hard to be mindful is the struggle of racing thoughts and busy minds and the co-occurrence of ADHD, but that's very common, and the amount of sensory input we're taking in and all of those factors. And so a lot of what the research says was incorporating our somatic movements and sensory regulation into mindfulness can make it much more effective for autistic people. Yeah. So a lot of the mindfulness techniques that we try to kind of stress or talk about are incorporating those things. So with stimming, it's an autistic person's natural way to regulate our body. It's how we naturally reach for stimulation. And so if that's already occurring, what better way to incorporate mindfulness than through stimming? Yes. So it really just kind of harnesses the same concept of like movement-based mindfulness or mindful yoga or those sorts of things, where you take the movement and you just incorporate some of that attention, some of that noticing, some of those kind of core skills of mindfulness into the experience. Yeah. And it can have an impact. It's not for everybody. Some people don't love it. That is, you know, the experience.
I absolutely love that. I'm like, I have the other program I have is a trauma-aware movement group. So
yes, I love that.
Therapy space is also something I love, but it's very, very useful.
100%.
I find this development really exciting because in the past, researchers and clinicians generally perceive, you know, stimming as a repetitive behavior, that it doesn't serve a function. And now, more recent kind of research kind of it's highlighting that they do have a function and that, you know, and then when we think about, you know, its function in terms of grounding and, you know, interoception, kind of more sensory-based kind of modulation, we kind of see the connection of that and mindfulness, right? It makes a lot of sense because a lot of the, you know, mindfulness skills that we teach our clients are, you know, they're sensory-based. So you can really see the connection of why we decided to, you know, to link, you know, stimming, mindfulness stimming, and, you know, the concept of mindfulness.
So good, which actually ties me to my next question, which is, I guess, the research and the evidence around DBT skills assisting an autistic client. What is out there about the research at the moment? Can you share that with us?
Yeah. So with Dialectical Behaviour Therapy, there's a lot of research on the use of DBT with BPD clients, so borderline personality disorder. And now it's expanded to other areas such as eating disorder, offending behavior. And there's a lot of more recent research on the use of dialectic behavior therapy with autistic clients. So definitely there is kind of some evidence that kind of shows that, you know, it's effective with this particular client group, but it is still in its infancy stage. So there's still not a lot of research. And it's good that, you know, that we acknowledge that there is definitely some evidence in the use of dialectical behavior therapy. However, our concern is that, you know, since this is a behaviorally based intervention, there's a concern of whether it's neurodiversity affirming. And therefore, you know, we strongly believe that, you know, modifying the program to make it more neurodiversity affirming, at the same time kind of making the most of the use of, you know, dialectical behavior therapy skills would be really a good kind of combination, right? And therefore, you know, we decided to develop the neurodiversity-affirming DBT program. So,
gosh, it's such an amazing program, and you feel, well, I personally feel like you filled a gap or a need within our psychology practice. It's a really great one. You're also now running workshops for professionals, is it? And sort of providing a bit more education and professional development in this space. Can you tell us more about your workshops and what you're actually running?
Okay. So we collaborated with the Emotions Clinic. So the Emotions Clinic is based in New South Wales, and they're kind of the interest and really the area is around autism, mental health, intellectual disability, neurodevelopmental disorders. So we collaborated with Dr. Belinda Ratcliffe, who is a clinical psychologist, and informed her that we're developing this program. And I think we got to the point where we felt like we're ready to run some workshops. So as part of that process, we developed a manual. We developed a program guide, and also the workbook.
Yes.
And Nimasha has done so much work on the workbook. It's more than
It is so amazing. I absolutely love it. It's so user-friendly as well.
And I felt it's also very timely because of the changes in the competencies for psychologists in 2025, where they're also acknowledging the need for neurodiversity and strengths-based kind of approaches.
Could you speak more about those changes? That might be good for everyone to know about.
Now included that, part of the competencies of psychologists is that, they need to develop their knowledge and skills in the area of neurodivergence, looking at more strengths-based approach and taking into consideration, neurodiversity-affirming practice. And that's the reason why we felt this was very timely in terms of running this workshop, because there are very few kind of neurodiversity affirming kind of therapeutic modalities that are out there. I've come across some work in the area of like the use of EMDR, eye movement desensitization, reprocessing therapy, and also schema therapy, but not with dialectical behavior therapy. And given
So it's a first program kind of thing, right?
yes, and
Yeah.
given that we've adapted some of the program. I've adapted some of the programs already. I just felt like this would be kind of timely, and in collaboration with Nimasha, it was really kind of perfect timing. And then, of course, the decision to run, groups, because we do envision that, clinicians, therapists may would see kind of clients in individual treatment, and if they want to kind of utilize a more neurodiversity affirming kind of DBT approach, then they can make use of our program and learn from our training workshops. So
Absolutely, because I feel like this neurodiversity-affirming DBT program is vastly different to a standard DBT program, and I know you both have done an absolute overhaul to create it. Do you think then, as you're running workshops, and Joseph, you're saying the competencies have changed because psychologists now need to have that knowledge of neurodiversity, psychologists obviously really need to spend a lot of time understanding the neurodiverse diagnoses, populations, nuances, how they present, to then be able to participate or run or understand your NDA DBT program? Did I say that right? NDA?
Yes. Yeah. You got there. You're good. I mean, I think that we will be it's a 2-day workshop. So the first day will be sort of covering some of that broad information about what neurodiversity affirming practice is, what DBT is, sort of covering that sort of initial knowledge base. And then the second day will focus more on the nuances of our particular program in detail. So I don't think there's a huge amount of prior information that needs to be learned before attending the workshop. I think we're kind of creating it so that we can explain and expand on all of those elements of it.
yes.
Amazing. I absolutely love it. I'm interested myself, so I will stay up to date. Oh, it's been such a meaty conversation. I absolutely love digging in about this topic. It's just a forever changing landscape, and sometimes I always feel like, even myself as a professional, do you know enough? Can you know enough? You just have to keep digging in to find out the answers. So thank you for an amazing, amazing conversation today. At the end of each episode, I have a few life ethos questions that I like to ask my guests. It can be a one word or a one sentence answer. I will give you two options because I've given it one word. That's really challenging. My first question is, if you had to leave a message for the community about the neurodivergent population, what would you want to share with them?
Oh, I'm terrible at being brief and concise. Um,
What do you
we
want people
treat,
to know about the neurodivergent population?
yeah, I think this is not my language. This is paraphrased by a million giants that I stand on the shoulders upon. But we treat distress, not difference. It's that I could expand, but I'm gonna for the sake of being concise, we treat distress, not difference.
I still love that. That's amazing. Such a good one. Joseph, what do you have?
So when we're working with autistic clients, it's providing support and not necessarily treatment. So treatment is for other co-occurring mental health issues, but in terms of working with autistic clients, it's providing support, validation, and also increasing their kind of self-acceptance.
Correct. You know what? I'm actually going to go a little bit more on that because I know we've spoken about it before, and I think it's amazing. I love that, this to me sort of talks about the person and the identity. And I know that in our profession, we want to make sure we're getting pronouns right, getting preferences right for any client that we work with. What are some of the things that you would use with the autistic population and the language and the terms that you would use so that the wider community can be across it?
Yeah, I mean, I think there's a lot of nuance to affirming language. One of them being, person versus identity first language. I think, there's a lot of use of, ASD, autism spectrum disorder. That is still sometimes needed to be used for assessments, and that's still officially what it is termed in a lot of clinical practice. That being said, in your everyday interactions with autistic people, we can just call people autistic. I think most clients, I don't remember exactly what stat it was, but a majority of autistic adults, the research says that a majority of autistic adults prefer identity-based language.
Yeah.
So referring to people as autistic, or even changing that final word of disorder to condition can be helpful. Recognizing that as the thread of all of this, it's different, not deficit.
So good. So good. Thank you for sharing that. It encapsulates what we were talking about so well. I have question number 2. Are you both ready?
Yes.
Of your NDA DBT program, what is your favorite skill?
Oh, that's hard. I'm terrible at being concise. Actually, I will say, my favorite skill is a check-in checklist. It is a tool we use to recognize taking care of our basic needs and recognizing interoception and sensory differences that come with being autistic. And my favorite part of it, and any participant of the program who has been there will know this, I have a little leaf a little leaf diagram at the bottom of it. It's just a little plant that grows, and I love her. She's my favorite, and therefore this skill will always have a special place in my heart because I think she's very cute.
Yeah, I remember that.
Yeah, to the point where my best friend printed out a little stack of notepad piece of paper that like rips the pages off of that particular handout because she knew I loved it.
Oh, that's so good. I know that our listeners cannot see the manual yet, but honestly, it's fabulous. It's pictures, it's easy to read, it's user-friendly. So you both have done a great job in developing that.
Thank you. Joseph, what's yours?
So for me, it's the NDA Wise Mind, right? Or the ND Wise Mind. So it's a new diversion Wise Mind. So we know that we have, the concept of Wise Mind in Dialectical Behaviour Therapy. But the way, of course, it's conceptualized. So it's really for a neurotypical Wise Mind. And therefore, what we did was we also developed the ND wise mind. So it's the neurodivergent wise mind. And part of the neurodivergent wise mind is, again, the acknowledgement of, self-acceptance, sense of identity, and, the reality of them having to kind of navigate, working with a neurotypical society. So, yes.
Good one. I love that one. It's so incredible that wise mind can actually be adapted for the neurodiverse population. So it's absolutely amazing. That's probably one of my favorites too.
And so,
Actually,
Nimasha, what's your experience with participants using the ND Wise Mind?
Yeah, I think it's very much the eternal struggle of many autistic people is finding balance. Balance is not necessarily always our strong suit. As we talked about a little bit earlier, cognitive inflexibility, that struggle of kind of that all or nothing thinking that can very easily creep in, the difficulty to shift our thinking. And so I think neurodivergent wise mind can play a really beautiful part in sort of trying to eternally re-find that sense of balance and kind of recognize that two things can be true once there is a middle ground. It's, very much that experience. And then, as you said earlier, like, it's also about bringing in that self-compassion and that self-context as well, because at the end of the day, the best thing about putting a neurodivergent label on top of everything is that all of a sudden there's a lot of self-compassion that can come in, and that is, very much a great part of the neurodivergent wise mind.
that's such a nice comment to kind of close off on, in that what we do, if your work and our work just allows for a level of self-compassion, I think that's an amazing thing in the program that you developed as well.
Thank you.
Thank you so much for your time. It's been an absolutely invaluable discussion, especially providing insights that we all need to learn and stay on top of for the neurodiverse population. So thank you so much for coming on. It's been a pleasure.
Thank you so much, Rachel.
Thank you, Rachel.
It's been lovely.
Much appreciate it.
If you'd like to access our team of psychologists for professional mental health support, please visit www.ethospsychology.org. Thank you for listening, and subscribe to Life in the Psych Lane on your favorite podcast listening platform to better understand psychology today.